Hello, I'm Dr. Arshnoor from Dr. Arshnoor's OET Institute. In the series of the role plays of OET, today's topic is for nurses, and the setting is hospital outpatient clinic. Students, one thing very important when you have any patient, and you have to check the setting first, because your introduction will be dependent upon that, and introduction is a very, very important part of any role play. In this case, hospital outpatient clinic, and 90% this patient is unknown. In that case, you may say, good morning or hello, my name is, whatsoever your name may be, and I'm your attending nurse today or one of the registered nurses working in this hospital. Then you may start with the second part. It is the information gathering from the patient. Now you find that the patient has come along with the child. Then you may ask that, how may I help you? The mother will definitely say that I have come. This will be her concern for what purpose she has come. Then it may ask that, what brings you here? As this case is the 7 years old child who might be suffering from some problem, and the mother has come to get her throat swab test done. Then the patient will ask you, get my child's throat swab test done. So I have an appointment today. Then you have to ask that, for the documentation purpose, may I check your child's identity, please? What's the name of your child? Then the patient may answer the name. It might be anything. Let it be, her name is Tina and she's 7 years old. Then you have to tell that, yes, ma'am, your child's appointment has been fixed with us, and just wait for time. We'll take her throat swab test. But before I could help you, I would like to ask you a few questions. If you're comfortable, may I ask? Then you may ask that, what is the reason for throat swab test? The mother may tell that she has been suffering from chronic cough, or she has pain in her throat. It might be any reason. Then it will be patient's questions, because she wants to gather some important information from you. And in that case, you may ask that, what's the reason for this throat swab test? Then your answer will be that it is to rule out any infection in the throat. And as you told me that your child has been suffering from sore throat and some chest infection, and in this way, the best way to get her investigated is to get her throat swab test done. Then the mother may ask you that, is there any problem? I mean to say that, is there any risk associated with this? Because my child is very young and I don't want to give her any type of trouble. Then you may answer by saying that, it will be better if you should ask her name first. In case of the elderly patient, we have to say Mr. and Mrs. But in case of the young patient up to 50 years, you may say that, you may call the name directly. Let it be the name of the mother, Sophia. Sophia, yeah, there is no particular risk associated with this. This is a minor test, and minor procedure, not the test, minor procedure, and they will just take throat swab that is on some cotton, will take her secretion from the throat. In this case, there might be some slight risk, discomfort, pain, and if the child does not cooperate with us, in that case, we have to face some problem. Then it might be the risk of gagging. These are the risk of gagging. So in this way, you may answer the question of the patient. Now, you have to suggest the patient to stay with the child so that she should be motivated and she should be emotionally supported by you. Because when a child goes for injection or any type of the procedure, the child may get afraid of. So to make her confident and comfortable, mother's presence is there. You have to tell her. Then describe analysis of throat swab. That is example. Culture grown in the lab, chemical tests show type of infections. As a mother has already told you that her child has been suffering from some sore throat or incurred any problem, which persistent chest infection or sore throat for the last couple of days, and despite of some treatment, she has not responded well. So you have to tell that this is a reason that this swab is taken, this swab test is taken, and in this way, the culture is grown in the lab, and the type of the infection that is investigated there, according to that, the child is treated. The antibiotic which is required for that particular virus or bacteria. So the type of infection that will be detected in only then the child will get proper response and the child will be cured very soon. Now you have to ask her. So before we start with the procedure, Sophia, I would like to know that has your child done mouthwash? I mean to say that if she has gone with the mouthwash, so in that case, we may not get the particular results from the throat swab test because the this mouthwash that may kill the bacteria which is required to be analyzed. So we are not able to detect the infection properly. You may tell that yes, it is I guess 2 hours ago, and after that she hasn't done any mouthwash, or you may say that hasn't done any brushing. Then now outline the effect of mouthwash. I've already told you. Resist giving a prognosis. Example, not your role. Yes. Now, in many of the cases, when the patient come to you and ask you that what is her prognosis and what do you suspect her to be suffering from, then you have to simply tell the patient that this is not my role by saying apologizing. I'm extremely sorry, Sophia, that I won't be able to help in this matter because this is the role of the GP or the doctor or the expert. Only that person is authorized to examine the patient and to diagnose the patient. And after that, the medicine will be prescribed by the doctor. I will not be able to assist her. My role is only to take the throat swab test and I'll help your child in that. Then give the details of the results that it is, Sophia, you have to come for the results after 2 days, as hopefully we'll be getting her results by then. And after that, I'll set your appointment with the doctor. And if the patient has already sent by or referred by some GP or the doctor, then you can tell the Sophia, you should see your doctor after 2 days with your reports. The diagnosis will be made by the doctor and your child will be prescribed the medicine which is required by her. By this, you may end up the task that now, if you're ready, if your child is ready, so should we start with the procedure? After getting the consent from the patient's mother, here is the role of the mother. So you may take the written consent from the patient, and after that, you should first thank her. I appreciate Sophia for your support. Now let's start with the procedure. It is a minor procedure. It will hardly take 5 to 7 minutes, and after that, your child will be free. Thanks for cooperating with me, Sophia. So I'm going to start with the procedure. So this was all about this task. Hopefully this task will be helpful for you to get some ideas and to practice role plays like this in your daily practice. And also if you get any setup of the role play in the exam, it will be helpful to perform in the exam properly. Students, if you have not subscribed our channel yet, so you can subscribe it right now so that you should be able to get the latest updates on the channel, as I'm planning to upload a new video every day. And in this way, you will be getting new role plays, which is quite helpful for all type of the students, especially for the nurses and the doctors. Um, if you like my videos, then do not forget to like and share it with your friends so that your friend too should be benefited from these videos. Thanks for watching. Stay connected. Happy learning. See you soon with a new video very soon. Thanks for watching.